Hello, my name is Dr. Becky Wong. I'm from the Otsuka Medical Affairs team, and today we are here to discuss about major depressive disorder. So what is major depressive disorder? Major depressive disorder is a brain disorder that affects how a person feels, thinks, and handles daily activities. The most common symptom is depression and loss of interest. But each person who experiences this condition has unique experience to the depressive symptoms. Now, a person may experience impairment not only in their social lives, but also at work and all their other daily activities, day-to-day activities. Now, the level of impairment for someone who had major depressive disorder ranges from very mild to very severe. For a very mild patient that experienced major depressive disorder, their impairment might not be noticeable because it's very mild, versus somebody who has very severe impairment that might affect their basic daily living, such as taking a shower or even feeding themselves. So what are the symptoms of major depressive disorder? Major depressive disorder is more than just feeling sad. Symptoms affect feelings, thoughts, behavior, and physical health. As you can see, there's multiple symptoms that a person with major depressive disorder may experience. Now, depressive mood, loss of interest, and pleasure in all daily activities are essential for major depressive disorder. And diagnosis of major depressive disorder require a person to not only have distress and or impairment of functioning. An example of impairment of functioning could be work functioning or even school functioning. So how common is major depressive disorder? As you can see on the map, it affects about 16.1 million Americans, and it is the worldwide leading cause of disability. And looking at the bottom, you can see nearly twice as common is seen in women versus men. And in the United States, the lifetime risk is nearly 2 in 10. So what does that mean, 2 in 10? That means out of two person out of 10, the risk of developing or having a major depressive disorder can occur during their lifetime. And it is also associated with other psychiatric conditions. So what is the cause of major depressive disorder? Brain changes are involved in the development of major depressive disorder. Changes in brain structure and changes in brain chemistry is what's the thought behind major depressive disorder. With every recurrent episode of major depressive disorder, this not only affects the brain structure, but it also affects the connectivity between each of the structure of the brain, therefore affecting the functionality of the brain. Now, looking at changes in brain chemistry, neurotropic factors are key contributing factors not only in birth, but also survival and growth of the neurons in the brain. And there are brain chemicals that talk to each other, and they're called neurotransmitter. And what has been observed and seen in patients with major depressive disorder is that it tends to have a low level of glutamate, serotonin, and norepinephrine. And their signal alter for dopamine receptors. So, are there other causes of major depressive disorder? There's several other factors that can contribute alone or in combination to the development of major depressive disorder. Genetics, family history, and environmental factors are all contributing factors for major depressive disorder. Now, there's no universal risk for genetic factors right now. However, family and twin study have shown that the risk of genetics is high and prevalent in people with major depressive disorder if they had a family history. Environmental factors such as interruptions in sleep or inability to cope with stress can also induce the development of major depressive disorder. So how is major depressive disorder diagnosed? There are several tests that are needed to diagnose a person with major depressive disorder. These tests are essential in regards to not only diagnose their condition, but also to develop the best treatment plan for that particular individual. Now, medical exams and mental health assessments are essential, but there are other tests that can help alter or at least pinpoint an individualized treatment for the patient. So physical exam, general medical history, possible diagnostic tests to rule out other conditions such as thyroid disorder, or even infection disease, present illness and current symptoms, current previous moods, personal history including major life events, social, occupational, and family history, current medications, and substance use. Now, with current medication, it's important to look at the medication because some of the medication, for example, like chemotherapy agents, antibiotics, along with steroids, can induce depression. So how is major depressive disorder treated? There's many treatments that are available, and the combination between medication and psychotherapy tends to be the best treatment option for patients with major depressive disorder. In regards to medication, antidepressant is the standard of care for the first-line treatment for patients with major depressive disorder. However, there's also lithium, thyroid medication, folate, psychostimulant, sedative hypnotic medication that can also be added to the antidepressant for the patient in regards to controlling their symptom. With psychotherapy, cognitive behavioral therapy, individual therapy, group therapy, problem-solving therapy are also effective measures to be added along with medication for the particular individual. Now, in regards to electroconvulsive treatment or therapy, this is only reserved for severe major depressive disorder patient who is not responding to the conventional medication or psychotherapy or the combination, and therefore this is considered the last resort. In summary, for major depressive disorder is a common brain disorder that affects how a person feels, thinks, and handles daily activity. The most common symptom is depression and loss of interest. The cause is unknown. However, there are several factors such as family history and environment that can play a role. Diagnosis can be made by a healthcare practitioner by performing medical exam along with mental health assessment. And there are multiple treatment options that are available, such as medication, psychotherapy, and other treatment to manage the symptoms. I hope you enjoyed this presentation, and thank you for listening.